Hi, I'm Dr. Sumithra, pediatric intensivist who has joined Aster Hospital. So we are a team of PICU trained doctors who will be there around the clock caring for children with requiring intensive care unit. So probably I would like to talk about trauma in pediatrics, which is I think most preventable, and most of it by taking a few precautions we can basically prevent most of these injuries. So it's sad that we still find a lot of children presenting to our emergencies with trauma. So most importantly, we have seen that we had a recently our studies which was conducted by one of our branches of Aster, which told most commonly which is occurring is less than 5 years. So we should be more careful with the children who are less than 5 years. And the most important part we found was almost 10% had a higher mortality who presented to us with a severe injury. So which could be prevented by a very smaller precautions which can be taken. So most important thing what we found another that study was that we had children who were mostly male had a bit of higher proportion of trauma occurring compared to females. And road traffic accident, though it was 50%, we found another 20% was at the home, which just happens from the fall from the height. So that could have been majoritively prevented. Most important thing as a parent is like avoid children's unsupervised and make sure there are like soft bedding which has been placed. The height of bed is not too much so that the fall doesn't happen from the bed. Or if you are living in a first floor, make sure that all the space between the rails are not too wide enough that the child can slip through that. That's what we commonly see, that sometimes we just like the child can fall out of the window or fall out of the slipping between the rails. So it's most important that you make sure the windows are there's no space for the child to slip out of the windows. That becomes very important for you. And as soon as any of these things happen, we have to get immediately child to the emergency. We have a good team of doctors who would be able to care for the child requiring this trauma support. Most important thing would be there's no severe brain injury that has to be significantly. We usually go through the child and see if there is any trauma, the child requires head CT or something, then we can care for that further. So to conclude, I'll be telling that any child, if in case your child has fall from a height, it's best is to come immediately to the hospital so that at Whitefield emergency we'll be able to look at your child and take a decision whether he requires further interventions or requires any imaging to look for further trauma for the child and take care the appropriate need of the child. Sometimes child may also require blood and blood products, so need urgent care to be done.